So good afternoon. Welcome. I'm Dr. Smith Arya School from Thailand. So I would like to welcome you all to my land and of course in this interesting session. Of course that this session we are sponsored by BTL and we have got two distinguished speakers. Of course they don't need any introduction. Dr. Diane Irvine Duncan, please give a round of applause to welcome her. And also Dr. Nurul Abdullah. Yes. So we will start with Dr. Duncan first. She will give a talk about periorbital treatment with IMCAS.
Good afternoon, and thank you so much for all attending. Do you have my slides? Oh, okay. Yes. So I'm going to start today with Brighter Eyes with M-Face. I'm a plastic surgeon from Colorado, just north of Denver, and I do a lot of clinical research and product development in regenerative and longevity medicine. So why are the eyes so important? The soul of the person is seen through their eyes, and I think a lot of my younger patients are worried about the appearance of their eyes, not only the upper eyelids, brow ptosis, but especially the area underneath the eyes. And why is this? Because if you look sad or you look tired, people attribute negative expressions to you. And a lot of patients come in with under eye problems. They feel like people are judging them at work because they look tired, they don't look like they're paying attention at work, and they want to stay youthful and relevant in the workforce. This is one of my patients, a 58-year-old, who came to me with just that problem. She was being passed over for promotion. She looked maybe a little bit old when she looked in the mirror. And my gold standard up until now for treating eyes has been fat transfer and laser resurfacing. So I treated her with some nanofat, I injected her lower lids, and I think that area looks quite a bit better. But we have a conundrum here because a lot of my patients want this result, but they don't want to have surgery. It's expensive, they feel that it's risky, and of course, nobody wants the downtime. So how do our eyes age? I think one of the biggest things that we see is not only bony resorption, we lose about 200 cc's of volume in our face just due to aging of the skull, but we also get laxity in the orbicularis muscle, and when this muscle doesn't retain the fat in the lower eyelid compartment, then you see protrusion and even a little bit of sagging of the area. Of course, lymphatics age as well, and we see puffy eyes due to lymphatic drainage problems. And then we have thinning skin. So there are basically three problems, as well as dynamic overexpression. If you laugh a lot, if you have the genetics, then you can get crow's feet. None of these look good on a person, especially as we get older. So patients want solutions when they come in to see me about their eyes. And most of them are looking for alternatives to fillers and alternatives to surgery. So if we look at lower lid blepharoplasty, I do these, but I would say maybe only 15% of my patients will sign up for surgery. Neuromodulators only really relax the crow's feet. They're not really good to take away hollowing, and they don't fill. Dermal fillers, of course, have a high rate of complications in the tear trough area. People don't like Tyndall signs. They don't like the white deposition if you use CAHA biostimulators. And, of course, lasers can help, but they don't fill, and they don't cure the problem with the protuberant fat. So here's a patient that I treated with M-Face for eyes, and you can see that she's got correction of the sagging, a nice improvement in her brow, and a nice improvement in her mid-face. She's 72 years old. She didn't want any surgery. She's actually paraplegic, and I think she has a beautiful outcome. So this is the newest addition to the IMCAS family, which was launched this year. And you can see the placement of the electrodes goes right underneath the eyes, but we're targeting actually the lower aspect of the orbicularis oculi, not just the area of the pretarsal region. So areas that this can be a good solution for: crow's feet, lower lid puffiness, and dark circles. Here's another one of my patients that I treated with M-Face eyes, and I'm combining this with the forehead applicator as well as the under eye applicator. This is another patient who is in her 70s, and you can see how the eyelids are open, a nice brow lift. This is actually almost a surgical result with a quick 28-minute treatment. Here's another patient that had a nice result with the under eyes alone. And you can see how it works by stimulating the muscle to gain tone. It's interesting because people were worried when we first started using the M-Face if they would get muscle bulk. And none of our patients get muscle bulk. They just get tonicity kind of right in the center of the muscle belly, which is where it gets lost with aging. And so you can sync the RF with the high fez. The temperature gets to 40 to 42 degrees. I'm working on a study now with BTL, and we're looking at the expression of heat shock proteins. So this is more than a mechanical thermal result. It's actually regenerative as well. So anatomical precision, we go low where the fat is protuberant, but not too tight in the preseptal region. And I think it's really important. BTL is pretty good at being precise in helping to reduce the fat and improve muscle tonicity without affecting the eye itself. There's been no adverse events or complications with this device. You can see the placement is pretty accurate just above the tear trough area. And this is a patient of mine who was treated. She was a 52-year-old smoker. You can see that the dermis is thickened. The vascularity visibility is a little bit improved, and the periorbital dark circles are quite a bit better. So thank you very much.
So thank you so much, Dr. Duncan, for an insightful talk. And yes, it's not just about the muscle, also about the brightening effect that we have from this new applicator. So next one, Dr. Nurul will share us about the combination treatment with M-Face and also fillers.
Thank you, Dr. Smith, for the kind introduction. A very good afternoon to everyone. My name is Nurul Ain, and I'm from Malaysia. And my topic today will be timeless, not transform, how we combine M-Face and also fillers. Okay, so these are some of the supermodels back in the 90s, and perhaps some of you might recognize. But if you see their facial features, you can see that they are very unique in their own ways. And they are pretty in their own ways. One of them, which I follow over the years, who's Cindy Crawford. And if you see this photo, this was probably her in her late 40s. And you look at her face, she still looks nice. She still looks fresh. And I'm sure she's had work done as well, but it is very tasteful, and you know that it's natural looking. And then fast forward, just recently, this is just in her in her 50s. You can still see the signs of aging, but again, she still looks like herself, right? So if you look at her before, when she was younger, and now, what is it that is captivating? Is that we preserve her look. So this is what I would say, something that is timeless, but not transformed. And we know that in the recent years, a lot of things have been happening and talks about the awareness of using fillers. So I think people have started to move away from the overfilled face. And this is where, for us, especially in non-invasive aesthetics, we must go back to our anatomy and understand the facial layers and actually how we reach aging. So today's talk is more on how to focus on combining whatever energy-based devices, especially like in my case would be BTL and FACE, and how we can combine that with fillers so that we avoid from actually overfilling our patients. So how I approach this is we can actually divide the face into 3 parts, so the upper part, middle, and lower. We look at it part by part and see how we can actually combine these treatments. So first we go with the upper third area, the forehead, glabella, temporal, and eyebrow position. To understand, we have to understand the process of aging. So what happens at the upper face, the forehead lines, and also the frown lines. So we know that due to the contraction, we get this because of the corrugator supercilii, the contraction, and also the procerus muscle. And for this, yes, we use toxin, but if those who do not want to use, there is an option for this. Then the next one is the temporal region. So we know that temporal hollowness is quite common, and especially in Asia, we don't really like the temple to be hollow because it is also associated with some form of we call it like feng shui. So to make sure that the temples are even fuller to give you better luck. So in some of the studies, it shows that the MRI imaging showed the soft tissue thickness of the temporal region actually decreases on an average about 3.4 millimeters in depth throughout adulthood. So we do see the significant changes, especially if somebody has been losing weight as well. Then the next thing is the brow. We look at it. Some people go through brow ptosis, some people go through elevation. The brow ptosis is because of the decrease in frontalis muscle activity, and then you have the lateral eyebrow droopiness, and in some people you get the brow elevation because they are trying to overcompensate. They are trying to raise their eyebrows and also compensate the laxity of the upper eyelid. So for this, we can use the IMCAS, the forehead applicator, whereby we'll be targeting the skin and also the muscle area. And in the paper which was published by Dr. Kotofana and colleagues, it was stated that not just by strengthening the frontalis muscle, but because it's like a sleeping bag, like a sheath where the suprafrontalis and subfrontalis fascia wraps the muscle. So when you improve the muscle, you will actually improve the overall resting tone as well. So it's important to improve the frontalis muscle in order for it to have the resting tone, the resting tone. Then the next one is where do we put the fillers? So for the upper part, I would say it's more towards the temple. So temple filler, you know there are a few ways to do it. Most of the time now the common one is the supraperiosteum, and we can see how this is important, whereby a temple that is fuller will look more rejuvenated. Technique-wise, there are some papers also that has been published where they thought about the dual technique, the dual layer technique. So it can be supraperiosteal, and some of them have also placed in the subcutaneous layer as well. So again, for the upper third rejuvenation, you can combine the IMCAS forehead applicator and address the volume loss with the temple filler. And then next, we go to the middle third section, which is the periorbital, mid-face, and nose. So the periorbital aging is as what Dr. Diane Duncan has already covered just now. And we know that in terms of bone resorption, it is usually the superior medially and also inferior laterally. And that is why you see at the corners of the lateral canthus is always downward turning. That is one of the signs of the periorbital aging. And we go into the mid-face. So for Asians, mid-face is very important because to begin with, our maxilla bone is already not as strong. So the support is not as strong, and a little bit of volume loss will then result in the tired-looking eyes. So Asians will always say that, we look tired, even in the 30s. It's because a little bit of volume loss will definitely result in that sunken or hollowness in the cheek and also the tear trough area. So usually the fat pads that you can see is deflated, which is the deep fat pads, and also the superficial temporal fat pads. And the other part which is significant is the muscle, whereby the zygomaticus minor, major, and risorius. And you know that the zygomaticus major and risorius is part of the modiolus, so it does affect the smile lines, our smile. So we do see that patients complaining to us that as they age, they look more sad, and that's because the depressor muscles is stronger and the elevator is slightly weaker, And that is where the M-phase applicator also plays a big role, because we are targeting these three vital muscles. So the M-phase cheek applicator is targeting specifically on those three muscles. So when it comes to targeting the M-phase, you've already strengthened the muscle. Then where would you fill up, which is the fillers? You can use the lateral cheek, temporal cheek area, and that is usually at the superficial layer. And with regards to the anteromedial cheek, it's normally the deep medial cheek fat. And if, let's say, people want to make it more natural looking, especially in the anteromedial, it's actually more towards the placement of the fillers. So lateral cheek normally is the superficial, and the anteromedial, despite, I know there are some papers that has been published which shows deep and also superficial, but personally, just how I feel over the years is that if you place it under the muscle, then it would be a better outcome that is more natural looking, so that when they animate, you don't see the fillers protruding out. So that is where you can place the fillers. And usually if the fillers are placed right, even during animation, you shouldn't be seeing anything bulging out. Okay. So middle third, again, where we can use the M-phase to address the muscle, the skin, and then we can use the fillers to address the fat area and also the bone. So now let's go into the lower third, which is the perioral chin and jawline. So the lower third, we know that the process of aging, the bone, it goes through a resorption as well. And then our depressor muscles become stronger as we age. So we know that even the platysma contraction and tension from the mandibular retaining ligaments can also distort this. And that is why sometimes we also combine things like rituxim at the platysma to improve the jawline. So some of the checklists when we are assessing the chin, normally we would see, like I would say, okay, whether there's overall symmetry of the chin shape, and then does it maintain the symmetry during smiling? Because if it doesn't, a lot of the factors are actually due to muscle contraction as well. And then we assess the side profile, whether it's balanced, recessive, or protrusive. And then we also see the cervicomental region. That is where we see whether there's the double chin appearance. So these are just some of the anatomical landmarks that you need to know, especially when you're doing filler injections for the chin area. And we need to also have some cephalometric assessment. We can use the Ricketts E-line or the Burstones, but sometimes, especially for Asians, the Ricketts is not as accurate because the tip of the nose is not really the highest point. So you can use probably the Burstone as just your rough landmark. And cervicomental angle, normally it's about 105 to 120 degrees. So if the angle is less, then that you know that you can actually improve the cervicomental angle. So this, for the device, we know that we can use M-phase for the submentum, which is going to improve the digastric muscle, because the laxity of digastric muscle will also cause the double chin appearance. So this one has the RF+, which also targets the subcutaneous fats, and high-fast will target the muscle. And on top of that, if you want to improve a little bit on the side profile, you can add chin fillers as well. So you can combine the M-phase for the cervicomental angle, and then you can put some chin fillers so that to improve the angle better. Okay. So how do you do the chin filler procedure? There's many techniques. You can see many papers being published on this as well. Some is on the bone, some is on top of the muscle. But if you want to create a physical myomodulation, it's best to put on top of the muscle itself, because then it will reduce the contraction of the mentalis muscle itself. So some areas can be on bone, and some areas can be on the subcutaneous layer as well. So there are some papers as well that's published that you read up, and it has both layer. It's a dual plane technique as well. So the lower third rejuvenation, again, will cover the skin and the muscle where M-phase takes place, and then fat and bone can be also addressed with the fillers. So I'm just going to share some 3 cases from my practice. Just bear in mind that with our practice, our patients are more on the conservative side. So most are not requesting like the celebrity, sharp looking, that kind of look. They just want something that's natural and subtle. So the first patient is a 50-year-old patient of mine who had lost about 10 kilograms. We do a lot of weight loss in our clinic as well. And again, she just would like to request to have a maintain natural looking. And so we combine IMCAS, the forehead and the cheek applicator, and just a little bit of chin filler, which she does not want any lengthening or anything at all. But if you look at the side profile, you can see that with the fillers as well, the submental or the cervicomental angle is a little bit improved. So this was before IMCAS submentum came into the picture. So we only had to combine the forehead and the cheeks and also the chin filler. So the kind of result that you get is something that is very subtle and also natural looking. So the second case is a 45-year-old who has she wants to reduce her eye bags and the tired looking. And you see the middle picture, this was again before we had the M-face. So we just improved the mid-face area and slightly just to support the under eye. But she lost weight along the way, and then we started using the M-face treatment for her. So it was only the forehead and the cheeks again. And you can still see the eye bags there. And when you review the patients, but you see that overall tone is good. And when we review the patient, then we added just a little bit more at the anteromedial cheek, and the eye bags are much better. So this is her progress coming from someone who has lost like more than 20 kilograms actually, and a combination of the M-face and also the fillers. So she still maintains her look. She still looks like her, but just a more refreshed looking. And lastly, my third case is a 35-year-old who has quite severe eye bags, but again, she's not looking for any surgical intervention at the moment. So we started her off with the mid-face filler first. Again, this was before M-face. We had M-face in our practice. So we just put in slightly of a mid-face filler, and then we had an M-face. And if you notice, before the M-face with the fillers, the corner of the mouth, if you see the lips, actually it's slightly downward turning. This is what I was talking about, the addressing the modulus, addressing the elevators, the zygomaticus minor, major, and risorius, because we can't do that with fillers. So obviously we need something that is targeting the muscles, and M-face is the device that is able to do so, and I see that in many of my other patients as well. And so somehow even your results, if you have fillers, it becomes a bit more sculpted, and it becomes a bit more, like I would say, blended and more natural looking. And then we review again, and we look at the face, and we see the length, and she wanted to improve a little bit on the lower face because it's slightly shorter. So then when we improve just by elongating 2 millimeters downwards, you can see that the chin is slightly better in terms of the projection. And so this is again a combination with chin fillers as well. And so this is how she looks like over the years, over 3 years of just mixing and mix and match between M-face and the fillers. But yes, I know you can still see the eye bags. So yes, when the eye bags, when the M-face eyes came to the clinic just not too long ago, we started her on this. So it'll be interesting to also see her journey and how she looks like after the M-face eyes. So yeah, in summary, I would say that now, looking at how we're going into aesthetics, where it's more towards natural looking results, I think it's really important that we know when to stop as well to overfill our patients. We have to learn how to combine the techniques of combining like energy-based devices. And in my case, I really, really like the M-face because it really helps with the muscle layer, something that we've not been able to achieve before this. Combining that with replacing some of the volume. And then, of course, if you have your skin quality treatments and your other injectables or your lasers, that would be the ideal to complete the holistic package. And that, in my opinion, is that what we can go with timeless but not transform kind of beauty. And with that, I end my presentation. Thank you.
Thank you so much, Dr. Nurul, for the very comprehensive presentation and very natural-looking results. So talking about the natural, Dr. Duncan, we come back to the stage again, right? And share her pilot study about the hyaluronic acid naturally gaining by another system, Exion.
Thank you so much. Those were lovely results. A beautiful presentation. Thank you. So my next topic is one of my very favorite things. I've done a couple of studies on the Exion. One was a veterinary study that's published in the ASJ Open Forum, and it's an open access article. So you guys can all take a look at that. And then, of course, a pilot study on Exion and hyaluronic acid. So I've had the device now for almost 3 years, and Exion is it's a multiple platforms in one device. It has fractional RF, it has a facial RF applicator, a body applicator, and an intimate health applicator as well. Everyone is a candidate. This is a device that is good for all skin types, and you can see a really great improvement in skin quality. There's lots of business opportunities and combinations that you can do with a very short downtime and pretty wonderful results without surgery. So the concept, multiple applications in a single device, is good for those of us who don't have a lot of space for devices in our office. And each device is unique. I love the RF microneedling. I've had many of these over the years. This is probably about my 8th RF microneedling device, and it's probably going to be my last RF microneedling device. The Exion Face is good, especially in combination with M-Face. It diminishes wrinkles, it gives you a smooth and dewy look, and it is wonderful for people who have sebaceous hyperplasia. The Exion Body hydrates crepey skin, and the MFEM is an intimate device that takes only 8 minutes and it's hands-free, doesn't require any manipulation. So how does the Exion work? It presents a patented combination of RF and targeted ultrasound that are delivered simultaneously. And so we have monopolar RF. The heat gets to between 40 and 42 degrees centigrade and provides not only thermal stress to fibroblasts, but some of the newer research that I'm doing with the company, we're looking at the expression of heat shock proteins and regenerative aspects as well. The targeted ultrasound is something that is really new, and this is the secret that produces more hyaluronic acid in the skin. So this publication, ASJ Open Forum, the superior effect of radiofrequency with targeted ultrasound, my pilot preclinical study, talks about the veterinary study and the amount of hyaluronic acid in your skin that really jumps off the cliff after age 40. Why is this? Because we generate senescent fibroblasts. This is actually a mitochondrial problem. And as mitochondria become damaged by photoaging, then we see the buildup of senescent fibroblasts that don't make any extracellular matrix anymore. And by the age of 70, we have maybe about 50% of the thickness of our dermis that we did when we were younger. So HA is a naturally occurring polymer in the human body, and it's synthesized and then secreted by fibroblasts, which actually secrete all of our ground substance, laminins, elastins, etc., of the ECM. The role of HA in the skin, about 50% of HA in your body is found in the skin, and it's really the primary source of hydration. It's also an important scaffold for the rest of our ECM components. Without the framework, of course, the dermis collapses, we become wrinkly, and the skin is thin. If you get stria, this is an extreme form of loss of dermal thickness, and this is, of course, a primary visual sign of aging as well. And so the study that we did was with 12 porcine, basically they were white Lincolnshire pigs, and they received 4 abdominal treatments, 1 with RF and targeted ultrasound, and 1 the RF alone. We looked at biopsies of the skin, including an RT-PCR and MALDI-TOF, with it basically it's a stereoscopic time of flight measurement, and confocal microscopy as well. If we look at the PCR, we saw a 71.5% increase in HA production. The MALDI-TOF, which is a spectrophotometer measurement, showed 224% increase in HA amount in the treated side versus the control side. And you can see in the confocal microscopy, the green is stained for immunofluorescent and stain for HA, and you can see quite a bit of improvement in the density of the HA in this study as well. So combination of synchronized RF and targeted ultrasound will see invigoration of the fibroblast, increase of metabolic rate, and reversal of secretory associated senescent phenotype, leading to ECM rejuvenation. If we look at the mechanism of action before the treatment, you can see a lot of the components are fairly thin here. We get homogeneous and deep heating of the dermal layer with reactivation of the senescent fibroblasts and increased extracellular matrix production. The RT-PCR, we can see improved dynamics in the tissue response, including hyaluronan synthetase, HAS1 and 2. So the synergistic effect, and this is really important, we're looking now at the target of optimal degrees centigrade. You really need to get above 40 degrees C to see any long-term difference. You're going to look at coagulation of the AH collagen and elastin fibers and gene expression changes in the fibroblast, causing them to not only be more receptive to radiofrequency, but to regenerate as well. So the RF and targeted ultrasound by themselves, and this is without microneedling, can really help patients with sebaceous hyperplasia. This is a problem without a good answer. This patient had a single treatment. We do recommend 3 to 4 treatments, and she came back to see me about a month later and said, well, I don't think it did much. Until we showed her pictures, she was a non-believer. I've not had a good response with sebaceous hyperplasia with any other device other than this. What do I love about BTL's RF microneedling? This is a unique device. I love the non-invasive aspect of this as far as there's not really much downtime. It utilizes AI or impedance technology, and every single needle will give you a feedback of impedance. And so, of course, your impedance measurement is a combination of electrical resistance, and so it's density, fibrosity, as well as hydration. Most RF microneedling devices, if they have an impedance measurement at all, it's a single measurement. And this device has 64 needles, and each of the needles will give you a different impedance measurement. And as the impedance changes, then the measurement of the energy output is going to be adjusted. You have deep tissue penetration technology, and so if you're using the non-insulated needles, it can penetrate 2 millimeters beyond your setting. So let's say the patient doesn't want to have a whole lot of pain. You set this device at maybe 1.5 millimeters, and it will extend to 3.5 millimeters. There's no other device that will give you deeper energy than the needle penetration other than this. So while the company doesn't really recommend that you use this device without the insulation on darker skin types, I actually do. I just turn the power down quite a bit. But with this setting, because you have non-insulation, you can get a single pass, and you can basically treat from about 1 millimeter to about 4 millimeters, because it will track up and down, depending on the pulse duration, and you can get a phenomenal outcome with a single pass. It probably takes me about 15 minutes to treat a patient's face. So here's a patient I used this for. I did a clinical trial with 14 patients, and we saw significant changes in the appearance of the skin 3 months following the last procedure. This patient had, as you can see, a pretty remarkable improvement in the under eye region based on just using the RF microneedling and topical exosomes. She also got some nice improvement of her jowls and pretty significant skin contraction. So we've had a 92% satisfaction rate, several studies that back this science. This is a patient of mine, and she was in my publication. She's 75 years old. I've treated her over the years. She's been my patient for about 25 years. I've given her a facelift, erbium laser. The thing that she hated the most was her acne scars. And it wasn't until I had this particular RF microneedling device that I was able to get a really profound improvement in her skin. Unfortunately, I've not seen her since. She's so happy. So this is a solution, I think, for all skin types. I rarely use the insulated needles. This is maybe for skin types 5 and 6. Otherwise, I'll use the non-insulated because I only have to do a single pass, though the company recommends types 1 and 2. I frequently use it on my Hispanic patients with skin types 3 and 4 with no incidences of PIH at all. So before and afters. Nice improvement in skin quality, decrease in pigmentation. This is a challenging patient of mine. She was a 4-pack-a-day smoker. I couldn't get her to quit. She had terrible neck skin and wanted a neck lift, and I told her I wouldn't do a neck lift on her because she's a smoker. So she said, okay, what else can we do? So I treated her 4 times with Exion and the Exion RF microneedling, as well as topical exosomes, and here is her result 3 months later. So she's had a beautiful improvement in the skin. We talked about a little bit about the AI using real-time feedback. Another patient of mine who had lack of jawline definition, and this is something that generally would require a surgical facelift. I think that she got a really nice improvement in her jawline with this combination. Another patient of mine who had some skin laxity, especially in the region of the mid-face, was on blood thinners and could not have surgery. This is a patient who is a television reporter, went on Ozempic and lost 35 pounds. She looks emaciated. Her company told her she needed to improve her appearance or she would lose her job. And this is her result after 4 Exion and M-Face treatment combination. So I think that Exion and M-Face are actually the magic combination. If we can help our patients look better, they feel better when they look in the mirror, then they don't have any risk or downtime. It's a wonderful opportunity to help our patients. Thank you so much.
Thank you so much, Dr. Duncan. So we still have time for our Q&A. And all notice that we are focusing on the natural results and a lot of the biostimulating effect from both of the system. So if you have any questions, feel free to ask now. Our staff will bring you the microphone. All right, so during this time that you're thinking about all the information, maybe I would like to ask both of you a little bit of the question. So the most frequent question that I've got, especially for the new doctors who is really not get used to the system of M-Face. Maybe I would like to ask you first, Dr. Duncan, that is there any chance that it may increase the wrinkles because it's about biostimulation of the muscle, especially when they do around the eye area, of course, the crow feet. Is there any explanation with this?
There is, and I would tell you that because we're not really giving the muscle more mass and more of a dynamic power. It's really more about tonicity at rest. And so if you don't have sagging of the muscle, then I think one of the important points that she made was people tend to have a negative facial expression with a downturned corner of the mouth, and you cannot really fix that with filler. So I've never seen a patient who's had increased wrinkles, although theoretically you might think that muscle stimulation would create that. There's a combination of the high Fez and the radio frequency that will contract the skin and actually make the wrinkles less. Have you seen any increase in wrinkles?
Not in my case. I mean, so far I've not seen as well. Yeah.
Yes. So it's focusing on the tone and the rejuvenation effect from both of the energy.
Yeah, the resting tone. Yeah. So I think the paper that was published by Dr. Swan, that was a good explanation on the frontalis because when it first came out, that was the number one question that everyone asked, especially the frontalis. Well, how does it not create more wrinkles? Yeah, but I think it's because we are improving the resting tone of the overall muscle. Yeah.
Yes. Yes, it's like creating the tone and it's not move too much with the laxity problems. I think that's the key. So do you have any question from the floors? If there's no question, I would like to ask Dr. Nuruz a little bit more. We can all see the natural results, great results from you. So I would like to ask you a personal protocol that if you have a chance to choose which system that you will use first, the fillers or the M-phase, and what is the period of time that you use as an interval between this?
So I think if we follow science, we would love to start with the energy-based device, right? Improve the muscle tone and all that, and then only we do the injectables. But that's not always the case in our practice because, you know, sometimes their current concern, that is usually what we need to address first. So I think we all know in aesthetics, we have to address the psychology bit of our patients as well. Yes. So if they came in and the hollowness is something that's really bothering them first, I would address that first. If that was the
It's
thing.
about priority.
Priority, right? Exactly. And if they have the understanding that, look, I would like to address your hollowness, but can I do this 4 sessions of M-phase first and then we go there? But if they have something, you know, that they're chasing or they need something that's fast, then probably we'll meet halfway. But otherwise, we'll do the M-phase, and then once they're done, we can then do the fillers. Because sometimes I noticed the amount or the volume that you need to use is a bit different. Yes. Because once you've improved the cheek area, the anteromedial, you may not need to inject so much volume as well for the anteromedial. So if we've already improved that, then I think it's also good for them because they do not have to pay more for the fillers, you know.
And more natural looking
and more
too,
natural
right?
looking as well, yeah.
And for you also, yes, Dr. Duncan.
So one of the questions that came up in the U.S., because we got the M-phase a little bit earlier than you did, was would the M-phase cannibalize your filler practice? If you used the M-phase on patients who already had fillers, might it not eat up or metabolize the filler more quickly? So my friend Yael Halas wrote a paper and did a study that showed that there was really no volumetric change in the area, the filler area, after the M-phase. If anything, there was a volumizing effect, and we've seen this both in the forehead and especially in the periorbital and cheek region of the mid-face, that if you do volumetric measurements using the Canfield system, we saw actually an improvement of an average of about 1.2 cc's per side in the mid-face after using the M-phase, and the filler stability seemed to be unaffected.
Yes. Oh, thank you so much. So, yes, you can see that there are many uniqueness in this both system. And of course, that if you need anything more about the information, you can ask our staff at the back. All right, so I think this is the end of our session today. So thank you so much for joining us, and I hope that you enjoy and get something new for your practice. Thank you so much.